Thank you, doctor. Thank you for your patience.
Yes, no worries. Everyone's being very patient.
Ahí está.
Okay.
Sorry.
All right. So I just want to comment on, I am a member of the Aesthetic Society here in the United States and actually the Plastic Surgery Society also. Also on the board of directors here in New York City for the Manhattan or New York County Medical Society. Next slide, please. No financial disclosures. Okay, finally, here we go. All right, media. So in the last year, literally 61,387 buttocks augmentations were performed in the United States, which includes implants and fat grafting. The BBL was searched, Brazilian butt lift was searched on Google roughly 200,000 times from January to May of 2021. On any given day on Instagram, there are 7.3 million posts that have to deal with the booty. Next slide.
Do you guys need translation? ¿Están bien o quieren que vaya traduciendo? Okay. En el 2021 hubieron más de 61,000 procedimientos de glúteos, de aumento de glúteos, que incluyeron trasplante y incluyeron transferencia de grasa. El BBL fue el search más buscado en Google 200,000 veces al mes entre enero y mayo del 2021 y actualmente todos los días ponen 100.3 millones de posts en Instagram en relación a glúteos.
Okay, so when did we develop a fascination with the buttocks? Well, actually, it dates 33 to 20,000 years ago BC with this little statue called Venus of Willendorf. This was the first known sculpture that signified an eccentric or an exaggeration of the woman's breast and buttocks. She was known as the mother goddess, a deity, a sexual fertility sculpture. And she's the first piece of art or religion that actually shows the buttocks.
33,000 años antes de Cristo. Oh my God, es la diosa de la fertilidad y es la primera referencia que se tiene de una Venus mitológica que tuviera pues glúteos grandes.
Okay, everyone should have some familiarity with this. This is Venus. Venus truly is, literal meaning is Venus Aphrodite of the beautiful buttocks. This is our first modern, somewhat modern, 1st century BC of the actual female form. And what is appreciated is the female form, the buttocks. The rest of her is covered, but not the buttocks.
Venus, como pueden ver, todo el cuerpo está cubierto menos la parte trasera. Es la primera referencia moderna que tenemos del cuerpo femenino.
But it wasn't until more modern times, during the Renaissance period, where we actually have Peter Paul Rubens, an artist, with his oil paintings and rendition of the buttocks. Several of his paintings showed the derriere, showed how voluptuous, showed what the female form was all about.
Y en la época del Renacimiento, Peter Paul Rubens empezó a pintar, a hacer estas pinturas donde se mostraban mujeres con glúteos amplios.
But everyone should know these three ladies. This is the modern day history. This is really what pushed everyone into the buttocks frenzy.
Todo el mundo debe conocer estas tres damas que han sido las que han empujado a todas las mujeres al frenzy de los glúteos.
We have Kim Kardashian is the first one, Jennifer Lopez the second, and Nicki Minaj the third. So thank you, ladies.
So you're in business.
Very much so. All right, but today we're only going to talk about BBLs, Brazilian butt lifts, fat grafting, and gluteal implants. I'm just going to ask if you guys are talking, if you just refrain from talking just for a moment. I can actually hear it. I apologize.
Si pueden, por favor, hacer silencio.
Okay, so let's start with anatomy. Once ever you know anatomy, then you can understand why we do what we do as surgeons, but what the individual wants, what our patients want. And that's what we're here for. We're here to do surgeries and procedures in the safest way to get the best cosmetic or aesthetic results.
Comencemos con la anatomía para que entendamos todo esto y estamos aquí para hacer procedimientos quirúrgicos de la manera más segura.
So this is a very simple pictorial of the three main muscles of the buttocks. The red one, the maximus, is really the number one muscle that contributes to the projection of the buttocks.
Estos son los músculos de los glúteos. El primero es el de arriba, es el que sostiene.
With the medius and the minimus, with the maximus, that contributes to that roundness that everybody wants to obtain.
Esos tres músculos son los que crean la forma redondeada que todo el mundo quiere.
So this is a more scientific picture, and it actually shows the gluteus maximus muscle, and it's quite a large muscle, as you can see here.
Esto es una foto más científica y muestra el músculo máximo, y como pueden ver es un músculo bien grande.
Connecting to the base of the spine or the sacrum.
Conectado a la base de la espina dorsal.
Fibers going down into the leg and to the pelvis. And
Las fibras yendo hacia las piernas y la pelvis.
And really giving us an idea how large this muscle is and how much it contributes to the aesthetic result.
Nos da una idea de cómo esto contribuye a los resultados estéticos de los glúteos.
So why do we do and it's successful? Well, it's successful because of the blood supply to the buttocks. It's a double-edged sword though, and I'll get into that in a second. The main blood supply is off the external iliac artery, and it's two main arteries, the superior gluteal and the inferior gluteal. Every time we have arteries, we have veins. They all go together, frickin' frack, twin A, twin B.
Estamos hablando del suplemento de sangre.
So we know when we fat graft patients, the blood is brought into that area which we need for our fat to survive. However, though, because we have the arterial system, the counterpart, the venous system, it's a direct connection right to the heart and lungs. And we're going to talk about what that actually means later on.
Ella está hablando de cómo todo la transfusión de sangre, la transfusión de grasa contribuye a la parte estética de esta cirugía.
So I borrowed this picture, and I want to thank Dr. Kuzna and Rutana. This is in his chapter. And this is a great picture because it actually shows what we're trying to do. The top picture is showing us that we're going to harvest and we're going to inject 700 cc's or milliliters of fat.
La foto de arriba muestra que van a insertar 700 gramos de grasa a los glúteos.
The yellow area is where the fat's going to go.
La parte amarilla es donde va a ir la grasa.
When you look at the lower picture,
cuando tú miras la foto de abajo,
you see the difference. Not only are we achieving projection with fat grafting, we're actually achieving a more rounded appearance also of the buttocks.
En la foto de abajo se puede ver la forma diferente comparado con la foto de arriba que tiene pues las partes están mejor alineadas y redondeadas.
So what's my experience? As I said before, I started doing this in 2005 and it really wasn't that popular. I didn't really get asked to do too many implants or fat grafting. But in 2019, I started every day getting consults for BBLs. And 600 cases of BBL, and that's actually wrong. That's 600 is in actually a 1-year period.
Estos son los números de casos que ella ha hecho de transfusiones o trasplantes de glúteos.
So it was hot in COVID. Everybody wanted a BBL. So
Durante el COVID la mayoría de la gente se hizo estas operaciones.
So I mostly do my surgeries under local anesthesia, but I also do some of them with IV sedation with an anesthesiologist.
Yo usualmente uso anestesia local, pero a veces uso también anestesia general.
So all the patients get some type of pain medicine, Percocet orally or Demerol, which is an IM injection, doxycycline or Bactrim, which are the antibiotics, Xanax for anxiety, and something for nausea, Zofran.
Esos son los medicamentos que forman parte del procedimiento.
So how do they handle the surgery when they're completely awake? Well, it's really from the tumescent fluid. And what is tumescent fluid? Tumescent fluid is lactate bringers, lidocaine, and epinephrine. And the lidocaine is based on an individual's weight. You take the amount of lidocaine that they can have and we distribute it to amount of bags. How many bags do we normally give a patient? Well, generally, we don't want to really go above 8 liters, okay? Most of the time in my patients, I'm like 6 or 7 liters of tumescent. But once that starts to work, the patients are literally almost pain-free with the procedure. I like to harvest the abdomen and the waist. I think it's the best fat. Then I go to the back or the extremities. I like to harvest what I like to call virgin fat because the fat isn't traumatized, it isn't scarred, and it actually has better vitality. It lasts longer and it has a more predictability of it.
La doctora está explicando de dónde toman la grasa para inyectarla en los glúteos. La toman del abdomen, de la espalda, de las extremidades. Y dura alrededor del procedimiento de 2 o 3 horas.
My times are usually between 2 and 3 hours. I'm a very quick surgeon. I like to put anywhere from 500 to 650 is my average, but I have gone and closer to 850, or as little as 200, depending on what my clients want, depending on what they need.
La grasa que extraen se la ponen en el glúteo y la cantidad depende de lo que el cliente desee.
And all the fat is placed in a subcutaneous space only.
Y se pone en la área subcutánea del... Aquí estamos viendo un video.
So here I am, I'm just drawing out the footprint of the buttocks. And you can see that in this particular patient, she's very much deficient, the lateral buttocks and her hips. That's where everybody wants it, right? Right where they're deficient, that's the one place we want it.
Esta paciente le falta pues le faltan caderas y le falta grasa en la parte baja de los glúteos.
So that's the area I like to graft first, or the ones that really need it the most. When you see those diagonal lines, that's the gluteal cleft. That's the area that I really want to stay away from because the blood supply is very superficial in that area. Once the lateral part of the buttocks is completed, then I move in and really focus on the projection once I get that roundness. So here's an example. The speed is obviously multiply faster than what I do in real life. But you can see I do it under power. I have a 4.0 cannula. I'm feeling the tip of my cannula at all times, and this is a lot slower in real life. I'm feeling exactly where that cannula is, and I'm putting little droplets of fat in multiple layers of the subcutaneous.
Ella está sintiendo en todo momento la punta de la aguja donde entra para saber dónde colocar la grasa adecuadamente.
So I'm injecting and I control the speed and I'm controlling the volume, and I keep going until I feel that my nurse tells me to stop.
Ella controla el volumen y la velocidad y ya se detiene cuando siente que ya pues es suficiente.
Or I get my aesthetic results. Okay, so I always like this picture, and as a surgeon, you know, we're always trying to make what we do better. We're always trying to strive for perfection. So here's a lady that comes in. She's obviously deficient in her lateral hips and her lateral buttocks. Here she is on the table. Wow, great, right? Home run. We always think they always look great on the table. And then 6 months later, much, much better, but not a home run. One of the things that you really need to talk to your patients about is that as much as I want all my patients to be Kim Kardashian, it's just not going to be. And oftentimes to get that look, it's going to require several surgeries. And that's a very honest conversation because many of them will say, hey, my sister had surgery and she looks great, but now I don't have the same result. And it's hard to explain to patients, well, you're not your sister, you're not your neighbor, you're not your friend.
La doctora dice que todo el mundo es diferente, que cada quien llega queriendo lucir como Kim Kardashian, pero que eso a veces no es realista o a veces requiere varias cirugías. La primera es una persona, pues obviamente deficiente en grasa en el glúteo. La segunda es después de la operación y la última foto es 6 meses después.
So we definitely like that roundness, right? The hourglass figure, but we really want projection. And this is actually a 62-year-old woman.
La foto es de una señora de 62 años.
Yes, 62-year-old women still get BBLs.
Para que sepan que las mujeres de 62 años todavía te hacen este tipo de operaciones.
So she was a great candidate. She was medically able to sustain the surgery, and she got an incredible result with only 500 cc's of fat, and the projection is night and day.
Ella tiene solamente 500 cc de grasa y como pueden ver los resultados son increíbles. Ella realmente necesitaba este procedimiento.
So a little bit of a magic trick, which is not necessarily, it's creating an illusion. So when we do BBLs, almost every single BBL I do, I want to lipo the back and the waist. This is to be able to show that beautiful S curve, number one, cinch that waist, as my staff says, snatch. And when you put the fat in, it gives an illusion that the buttocks is larger than it really is. And that's a combination of liposuction and fat grafting. And with all my patients that undergo surgery with me, I really emphasize that those two need to be hand in hand and gone together to really get the ideal result.
Dice que mucho tiene que ver con la ilusión y que ella siempre que hace este procedimiento pues también trabaja en la espalda y en los lados con liposucción en esas áreas para crear la ilusión de que el trasero es más grande.
Now, all patients know that about 40% of that fat is going to go away in that first 4 to 6 weeks.
4 to 6 weeks.
4 to 6 weeks.
El 40% de la grasa que se aplica en un transfer sale en 4 o 6 semanas, solamente queda el 60%.
So my patients ask me why. Does anyone know?
Los pacientes le preguntan por qué. ¿Alguien aquí sabe por qué se pierde el 40% de la grasa?
Yeah, usually they don't. But the reason is blood supply. The way the fat works, it has to grow a new blood supply. So that blood supply is a very thin little line, like a baby, like a brand new baby, very gentle. And if there's any trauma to that baby or any kind of action on top of it, will disrupt that blood vessel, and then it has to start all over again. So that process is actually going on much more than we actually know during the first 4 to 6 weeks. So that's why we get that 40% buttocks fat loss.
Dice que por el suplemento de sangre, pues la grasa se empieza a eliminar.
By the time you get to 6 months, your buttocks is like your second child, right? Let them go out and play. You don't really care. They're crying. Oh yeah, they're fine. You know, change their diaper. Okay, you know, you're not so on top of things. By 6 months, that fat is yours. You lose weight, you're going to lose the buttocks. Gain weight, you're going to gain the buttocks. But no matter what you do at that point, it's pretty much yours for life.
Lo que después de 6 meses ya los resultados son permanentes. Usualmente, pues si bajas de peso, tal vez te baje el trasero. Si subes de peso, probablemente te aumente.
So again, I tell my patients, as much as I like to be a magician, I'm not going to change your body. I'm only dealing with fat. I'm not touching your muscles. I'm not touching your bones or tendons. So the asymmetries are still going to be there after surgery. And it's important to point these out to patients beforehand. This is a great result, but still an asymmetry, which was pointed out pre-op.
Dice ella que ella no es un genio ni tiene una varita mágica, que ella solamente trabaja con grasa y hace lo mejor que puede. Pero ya el cuerpo natural de cada persona, pues eso ella no lo puede cambiar.
So 6 weeks, I see them back because I want to see how much fat actually dissolved. With her, I got pretty lucky. I wish all my patients were like that. She follows directions. And very happy patient.
Después de 6 meses ella los ve a los pacientes para ver cuánta grasa pues todavía retiene.
But not all of them are, because there's actually complications. And I love when patients ask me, well, doc, is something going to happen? Can something go wrong? And I always like to use the analogy of like, do you drive? Anybody that drives probably has been in a car accident.
Pues,
Not their fault or someone else's.
Siempre hay la posibilidad de complicaciones en procedimientos de ese tipo.
Then I go one step further. Between the ages of 18 and 45 in the United States, the second cause of death behind drug overdose are car accidents. That many people die every day, except we don't really think about it.
Entre los 18 y 45 años, la mayoría de las muertes después de drogas son accidentes de carro.
So we can put our patients at ease. So what's the worst? You know, what's our risk or complication? Mostly in my practice, it's the outcome. They really go in thinking they're going to be Kim K, and they're just not. regardless how much I say that to them. Size and shape. Infection, generally in the summer months, and personal hygiene, that goes up a little bit. Fat necrosis, because of trauma to the buttocks, it ends up the buttocks fat, when it dies, it doesn't actually dissolve and go to the kidneys, it actually stays there and forms a hard rock. We recognize it, we want massages, and in some places, and sometimes you have to stick a needle in there and remove the fluid. Seroma is a fluid collection in itself, not bad, but after a while, it can have bacteria, and that can cause a severe infections. And I probably can bet that almost everyone knows somebody that had a really bad infection from this procedure.
La doctora está explicando las diferentes complicaciones que pueden ser infecciones, pueden ser necrosis de la grasa, seroma, las personas disatisfechas con la manera en que le quedó el tamaño o la forma.
So there is another complication that I wasn't able to add on that, is lidocaine toxicity. And how I mentioned before is the amount of lidocaine that we put into our bags is measured by a formula that takes in consideration of their weight and gives us an actual amount. Lidocaine toxicity is actually fatal and happens more often than us surgeons like to admit. So these are things that can happen in real life. But let's concentrate on the last three, because the last three are actually the ones that probably everyone in the media focuses on and everyone in the societies focus on. Deep venous thrombosis is a blood clot in the leg. It can happen from anywhere. Venus Williams, #1 athlete in tennis, got one on an airplane, right? She is the best in shape woman ever, and she got a blood clot. So the blood clots can actually happen pretty frequently. When that blood clot moves, it can go to the lungs, and that's called a pulmonary embolus. And that is one who has shortness of breath or coughing. Unfortunately, they can have this 4 weeks or anytime within 4 weeks of their surgery. A little bit unusual to have it after 2 weeks, but they still can.
Una de las complicaciones más severas podría ser los coágulos de sangre que se pueden ir a los pulmones.
These are pretty critical problems, and we always also want our patients to be happy with their outcome. We really want them to be safe. So they know right off the bat that any kind of shortness of breath, they go to the ER. They don't ask their friend. They don't go up and Google, Dr. Google or Instagram. Yeah. They go right to the ER and they call me. Luckily, knock on wood, this hasn't happened.
Por eso ella recomienda que cualquier complicación la llamen y que se vayan a emergencia.
Okay, so fat embolus. This is a big one. 1 in 3,000 people that undergo this surgery have a fat embolus. I think that number is still a little bit vague, but that's what they're coining.
What is a fat embolus?
Fat embolus is a fat clot.
Embolia grasa.
Embolia grasa. Uno de cada 300 pacientes.
Okay, and this by far is the most deadliest risk from this procedure. As surgeons, as doctors, this is very difficult to treat and to manage. And in most situations, unfortunately, it is fatal.
Esta es una de las consecuencias más drásticas y casi siempre termina en la muerte.
Okay, well, because of all this, New York State has done a BBL task force, and it's worth mentioning because it has really changed the scope of plastic surgery on some level. So who can do the surgeries? Well, board-certified plastic surgeons, ENT, and dermatologists. Cosmetic boards are not accepted. What's a cosmetic board? I don't know if you guys know that, but it's the one-year fellowship or one cosmetic board. The American boards do not recognize it as a real specialty. Now, when you look up there, I bet a lot of you are going, why is a dermatologist doing a BBL? Well, technically, they can, but they have to have hospital privileges. They have to be able to do it in a hospital, and then they can do it in an outpatient setting. And that goes with your ENT, your plastic surgeons. And the reason they've done this is they're taking away the ability for people who have no training that take a 3-hour course on a Saturday and now are an expert in doing these surgeries.
El Estado de Nueva York tiene regulaciones bien estrictas y específicas para cuáles personas pueden hacer estos procedimientos. Tienen que ser certificados, dermatólogos, tener privilegios de hospitales.
They also put time limits on us. The surgery should be 2 to 3 hours. If it goes beyond that, they need to stay in a recovery room for at least a couple of hours and be monitored. If it goes beyond 6 hours, they have to be admitted to a hospital overnight. They're only injecting into the subcutaneous pocket. Now, in many other countries, the fat has been injected in multiple layers, and there's a lot of surgeons that have injected below into the muscle and been absolutely fine. But here in New York, that is no longer acceptable. The fat has to be in a subcutaneous tissue. And one step further, within the last week, Miami or Florida has had an emergency medical act that requires all surgeons to use ultrasound when injecting fat into the buttocks to make sure that they're in the right place because of how many deaths associated from this procedure. And then lastly, IV fluid replacement, which you think sounds reasonable and for everybody, but not everyone does it. Okay, let's talk about gluteal implants. So I want to thank one of my colleagues, Ryan Stanton. So we
Ya
had
va a hablar de la historia de los implantes de glúteo.
the first documented buttocks implant is actually 1969.
1969. El primer implante se hizo en el 1969.
And it's actually from, what they did is they took the Cronin breast implant. So those are us in the industry. The breast implant was actually taken, and in that particular young lady who had an asymmetry because she was missing her muscle, they put the breast implant into the buttocks. Great idea, right?
Pusieron un implante de seno en el trasero cuando lo hicieron en el 69.
I mean, it sounds reasonable, except that the booty's under extreme pressure all the time, and you're sitting on kind of this cushion, and it's not going to really retain the shape, and lo and behold, there's tons of problems, and she subsequently had it removed. But the idea kept. So then in 1973, Koch and Ricketson actually performed the first cosmetic one.
En el 73 se hizo el primer implante cosmético.
Well, they didn't have that much luck either because there were still a lot of problems. So in the last 15 years, since we've been doing this, there's been an actual ton of different types of implants, and there's pros and cons. There's pros and cons on patient selection, what pocket to use, what type of pocket, what kind of implant, all these things. So one of my colleagues that I work with really well is Dr. Stanton. He's developed his own patented buttock implants, okay? And these are anatomical implants. They're softer and they're thinner and they cause less problems. He's done 765 cases between 2013 and 2021, and that hopefully is going to be published in the Plastic Surgery Journal one of these days. These are just a picture of the different implants, the different projections on the bottom. Anatomically, the butt's not round. It looks round, but it really isn't. So it is shaped to really augment or to mimic, sort of like the gluteal muscle, which I showed you before.
Esos que ven ahí son implantes de glúteos, no de senos.
Okay, so this is Dr. Stanton. There's his implant, okay? Puts it in a little funnel. We all do that in plastic surgery for breast. 2 gluteal incisions, perimedium. He does an intramuscular pocket, make sure it's great, it's clean, it's open, and then we pop that little implant in. We make sure that it's aligned correctly, and look, instantaneous.
Como pueden ver, introdujo el implante. Se parece similar al implante de senos, pero este es un implante de glúteo.
Why is this sexy? Well, number one, it's permanent. There's no 40% or that variable that the fat's going to go away.
La diferencia de este tratamiento es que esto es permanente, no es como la grasa que se va y que se palca 40%, esto es permanente.
Well, what about those really thin people?
¿Y qué pasa con las personas muy delgadas?
They actually do exist, where you can't get an ounce of fat off of them. So
Donde no tienen ninguna grasa que se le pueda sacar para esto, entonces esas personas hay que ponerle implantes.
And now our newest population, the transgender population, extraordinarily popular now, is to have the implants.
Ahora también la población de personas transgender se están haciendo mucho este tipo de procedimientos.
So looking at the implants, you can have as much projection as you want. You could have the shape that you want. You could be just a little pop. It could be exaggerated. You can do whatever you want with the implant.
Con los implantes tú puedes hacer lo que quieras, ponértelo como quieras, el tamaño que quieras, la forma que quieras, porque tienes esa flexibilidad.
And basically just reconstructing that buttocks implant or foot plate, or footprint, to re-establish the booty. And this is just a great picture too. Not so much the sides, but really more the projection for this individual. But we have both.
Those are perfect.
We can do implants not only for the buttocks, but we can do implants for the buttocks and the hips.
Se pueden también hacer implantes para las caderas. Se pueden hacer implantes del trasero y también implantes de cadera.
So we can hide the incision for the buttocks implant in the gluteal cleft, but we also strategically are hiding it in the G-string for the hip implant. Yes, there are 4 incisions on you, but those women that really want that look, they don't have a lot of options.
Para la de cadera se esconde la incisión en la parte como del G-string para que no se vea cuando pues tenga ropa interior o vaya a la playa.
So I conclude my talk today. Thank you very much again for allowing me to speak on one of my favorite subjects, and I'm happy to take any questions.
Un aplauso para la doctora y si tienen preguntas. Preguntas, ¿tienen alguna pregunta? Bueno, pueden hablar con la doctora en privado. Whoever has a question can reach out to the doctor. Doctor, how do we get a hold of you? Do you have?
Yes, I apologize. It's LoTempio Plastic Surgery for Women, New York. Max, what's our Instagram and TikTok?
It's
New York Doctor? God, I don't even know it.
Just
Sorry.
it's LoTempio Plastic.
I'm a LoTempio Plastic Surgery for Women. You can Google me. I'm all over TikTok. I think it's Dr. LoTempio, New York City, NYC. And on Instagram, which lovely, that's how you all found me, so I appreciate that. Thank you.
Thank you so much. Thanks to you.
Yes.
Any questions?